Hi, I'm Sherry Harlan Davis, program host for Reid Beside You. And today we have a great episode, and we're going to talk about active lifestyle, active brain. And today we have guests from our Reid Athletic Training Center, as well as some people that will speak about Love Your Brain. So I would like to welcome Jesse, Matthew,
Hello.
and Savannah. Welcome
Hello.
to Reid Beside You. And first, we want to talk about what's going on in the Athletic Training Center, clinic rather.
So the athletic training clinic is meant to be a housing for all the local athletes and active lifestyle people. Mainly for injury stuff, but we don't want to just discredit anything else. So we have maintenance and recovery aspects as well. So we have athletic trainers at all of our local schools. A lot of those schools don't have a lot of treatment options for these athletes. So we created a place that has a bunch of different modalities and treatment options and things for these athletes to come up and hopefully get better and get back in the game quicker.
So Jesse, when you're saying treatment, can you give me an example of the treatment that you offer?
Yeah, we have a bunch of different treatment options. We have e-stim, we have ultrasound, we have cold and hot whirlpools. We have two of our athletic trainers here, myself and Trey Holler, are certified in rock pods, rock floss, and rock blades, which are all different types of modalities depending on what you need. And on top of that, we also have a Thermex modality, which is kind of our athlete favorite. I would say a majority of our athletes that come in here end with a Thermex, which is a hot, cold, or hot and cold compression therapy. Just an amazing tool that we're lucky to have here.
And all of those treatments, are they used in various phases of rehab or recovery?
It really just depends on what's going on. There's certain instances where we got to focus on swelling. So we'll do a lot of compression therapy, maybe use some of the rock blades that we just got certified in. If it's not really a swollen thing, then we have a full room out here full of gym equipment and weights and bands, so we can focus on rehabs as well.
But you're first and foremost, I'm sure that you look into preventative measures for your clients.
Between us and Matthew's program, actually, as well, we can focus on some preventative measures as well.
And let's go back on the clients that you serve. So traditionally, when someone would hear of athletic training clinic, they would assume it's in a local college or high school or middle school athlete that needed assistance. But more and more, we like to see as our entire population, as they age, people are keeping up a more active lifestyle. So how do you work with all groups?
Really, it just depends on what comes in the door. We also have a new addition to the Reid Health Comprehensive Bone and Joint Center, formerly known as Reid Orthopedics. Dr. Godrowski likes to focus on an active lifestyle as well. So before we were just seeing kind of middle school to college age athletes, but now we've broadened our scope and are starting to see the YMCA players, just the people that are the gym rats that maybe have something that's tweaked. And again, depending on what they come in, we'll take a look at them. If it's something that we can handle, we'll offer a treatment and rehab package for them. If it's something that we think maybe needs to go a little, a step further, then we have that referral right there to Dr. Godrowski as well.
And we're very excited to add Dr. Godrowski to the Reid team, as we all know that he's also a very active person himself. So that's always good to, it's not that he's just talking about it, he does that. Tell us about your trainers. and how they work through the community.
Yeah, so right now we have 12 athletic trainers, including myself. We do have 3 PRN athletic trainers as well. We cover 12 total schools, 2 colleges, 10 high schools. We go as far north as Winchester and Union City. We go as far south as Connorsville. And then we go as far west as Hagerstown and Lincoln High School as well. So we have somebody at all those schools, at all games, most, if not all, practices, just making sure that we're the first ones there and things get handled right away.
Then another good thing I want to add is how most of all your trainers were former athletes themselves, so they can really empathize with the players when they do come and need assistance.
Absolutely. Yeah, I would say majority of us are former athletes. I would say a majority of us probably had some injuries along the way as well. I, for one, didn't have an athletic trainer when I was in school. Sure could have used one quite a few times. But yeah, it definitely helps to have us on the sidelines day in and day out.
And you also offer a program. What is your post-discharge program?
Yeah, so our post-discharge program is for clients that go through formal therapy, any sort of formal therapy. If they feel like they maybe need those extra sessions or something that maybe insurance won't cover, that's where they can kind of graduate to our program. We talk with the physical therapists and get kind of their exercise routine down. But this isn't therapy up here. We are trying to bridge the gap between formal therapy and going back on your own. So we get the clients that come in here that want to participate in this class, and we show them how to use all these machines on their own. And it's really a at your own pace kind of thing. We have 2 or 3 athletic trainers for every class, and they're there to help if anything is needed. We're obviously there to clean with everything going on with COVID-19 right now as well. But yeah, we really want you to build that comfort in a gym setting. So that way in 4 months, it's time for you to kind of spread your wings, feel comfortable to go to a class or go to a gym because you've attended our class before.
Help me understand the difference. If a person had been going to the rehab facility, and then do they start going to the athletic clinic? How's that work?
It's really up to the patient. If they feel like they want a little extra work, but maybe they're not really sure about the gym setting, it can be kind of a scary place if you've never been in there before. That's what we're here for. It's just an easygoing class that just kind of, like I said, works at your own pace, gets a total body workout. We're not focusing solely on the injured structure that you were in therapy for. So we just kind of do a well-rounded workout with our weight equipment. We even kind of tailor some specific things that we kind of think outside the box that's not a traditional weight machine. We'll grab some balance pads, we'll grab some bands, we'll just utilize anything and everything we have up here to try and meet your needs.
So actually, the individual everyone's pretty much custom.
I would say majority of them, there's 14 weight machines up here, and I would say a majority of them use a lot of those, but then we throw in some custom things in there as well.
Okay. And how do people become knowledgeable about the moving from rehab to the athletic training center? Can I just call and say I want to join, or do you need a recommendation?
You can do one of 2 things. You can contact the athletic training clinic. The one requirement is, again, that you have completed your formal therapy. That is a for sure requirement. Otherwise, you can talk to your current therapist right now and ask them about the post-discharge program. They have a flyer that they can give you, and then you'll get in contact with me.
So, and but overall, it's really good to know that there's a flow that people can come from, going straight from rehab to graduate to the athletic training clinic, and then hopefully getting them back to their own gym life.
Absolutely.
Great. And I always like one of the things that you were saying, that we like to get you back to your former sport. That is your goal at all times.
Yep. So whether you're an athlete or a former athlete or whatever, we kind of meet all needs up here. And again, it's to get you back to your game, whether that's a sporting event or whether that's something just a normal daily activity that you enjoy doing.
Great. Well, hopefully everyone has that number, and then when the time comes, or if they just thought about it, they can speak with their doctor or Dr. K, and meet with the athletic training clinic. And thank you, Jesse. I want to, our next part, I want to talk about Love Your Brain. And this is very interesting. So before we talk about Love Your Brain, can you tell me about what is medical fitness?
Yeah. So medical fitness is one of the newer departments for Reid Health, probably 3 years old. And it's the department that our whole goal is creating programs to help improve clients' overall health and quality of life. So these programs can vary anywhere from, just those that have been diagnosed with a chronic condition, all the way to those clients that are just looking to, improve their overall well-being. So a lot of that is growing in this realm. We have boxing programs, they're like Rocksteady Boxing, the Baby Boomer Fight Club, that have been pretty established. We have the new yoga programming that we're offering, with Love Your Brain being one of those. And we also, have some other, like your sports performance program and your, fall prevention. So we kind of run the gamut of everything, but yoga has kind of been one of our growing programs, and Love Your Brain has been a big part of that. So yeah, it's medical fitness.
And one of the things that I found interesting before we go into Love Your Brain, that 3 million traumatic brain injuries occur within the U.S. and Canada every 11 seconds. Yeah. So I found that very interesting. And that adding in the yoga part is just transforming, just like the Reid, our statement is, we're getting people for our well-being. We want to make sure the well-being of the whole person. So tell me more about Love Your Brain and the purpose of the program.
Yeah, so Love Your Brain is a 6-week program. It's 90 minutes each week. So we start off with a little breathing exercise, kind of calm everyone down, get them in the mood. And then we go to our poses. So we go through about 45 minutes of the actual yoga portion, and everything is tailored specifically for brain injuries. People with brain injuries deal with dizziness, possible seizures. So we do have accommodations for things like that. And then we go to our Shavasana for about 20 minutes, which is our resting period. So you lay there in silence with music in the background, kind of connecting with your body, just giving yourself that time to rest. And then at the end, we do have a group discussion. So that's about another 20 minutes. So that's probably the part that people like the most, is that sense of community. We get to talk about what they've been through and how they're coping with it.
And I'll ask for Matthew on this one. Explain about this, how this is based on science-based benefits of Love Your Brain.
Yeah, so actually the whole story of Love Your Brain started with a snowboarder who had a very traumatic brain injury. And so they did a lot of, research about how yoga helps the overall body and helps, come to terms and with with your injury and kind of the mind portion behind it, but also, like Savannah mentioned, balance and everything. So they've this is all kind of shown. Yoga's been around for a long time, but they're starting to see the importance that it happened and that that it does for the body. And so they kind of did some studying to see the yoga, how it affects with traumatic brain injury, stroke, other acquired brain injuries, and saw that there was a lot of improvements, like improvements in your overall well-being and your balance and your strength, and your kind of acceptance with what you're dealing with. So yeah, it's just kind of yoga's that new age, or I would say old age, but it's been around forever, but it's kind of coming into helping a lot of these other diagnoses that we're looking at with medical fitness. And Love Your Brain actually was put on our radar because in this area we don't have a lot for traumatic brain injuries. One of the physician neurologists for the hospital actually approached us and asked about we need to do something for our organization. And so we went through. It's a Love Your Brain is a clinical affiliate program that you are part of. We are the actual second clinical affiliate in Indiana, and we're actually the fourth in our surrounding states. So not very many are around. Reid is kind of one of the growing the pillars of Love Your Brain in this area. So I just think it's amazing to be a part of this organization and bring the science-based, yoga practicing techniques to our patients in this area.
And the first time I wasn't aware of it, but after watching some things from the Winter Olympics and seeing the accident the skier had, and learning more about, so I think becomes more and more. Brings more awareness to Love Your Brain. So who are the clients that are served, and what is some of the criteria to participate?
So you basically have to have an acquired brain injury. That's the only criteria we have. So stroke, history of concussions, lack of oxygen to the brain for a certain period of time, anything like that. So an injury that you didn't have before and now you have. So those are pretty much what we serve. So wheelchair, we are wheelchair accessible, so we offer that in our classes as well.
And so those are the examples of who's served and the various criteria.
Yeah.
Tell me about the program itself.
Okay, yeah. So like I mentioned, it is a 6-week program. So the participants have the option to go through the program twice. And then once they go through the program and they feel comfortable, we do have a few graduate options as well. And we are also looking into offering this as inpatient as well. Right now, we are only outpatient. So this could be weeks or months after the brain injury, even years. They would come to us after release from the hospital. So we are looking into maybe joining ARU and then having our services there while they are still in the early stages of recovery.
And is that a requirement that they have to be in early stages, or if they're just now learning about this and would still be interested, can they still participate?
Yes, any stage of the brain injuries is acceptable.
And the pricing, can you share about this program is free of charge?
Yes, this
With
program
internal?
is free of charge. The 6 weeks is completely free. We do charge for the graduate programs.
Okay. How many people have gone through this program?
So far, we've had about 30 people that have graduated our program. So
And
we've offered it 4 sessions.
And we hope that now that people will learn about your program, it won't be a best kept secret anymore. And that's just will be part of the process that more and more people will learn about. Have you had is there a way you can share a story about a graduate?
Actually have a testimonial here from one of our ladies that she went through the program twice, and she is in our graduate program currently. She said that yoga has helped with my balance. My balance was thrown off after my stroke. I feel like I can do everyday tasks easier now. Yoga has helped with my strength and flexibility. Great program.
And that's
just one
always
of
good to hear.
many testimonials that we have. So.
And that's a feather in the cap for all of you, that you're doing the right thing, as well as the physicians that have referred, that asked to bring this program to our community. And I know that you said you had the 6-week programs. Like, you've had 4 6-week programs. Is there a certain time of the year they're hosted? Tell me about that.
We don't have certain dates that they're offered. It's basically once we get a certain number of participants, we like to hit around 6 or 8. Once we have that many signed up, then we come up with an official start date. So we're currently in the referral process. We're waiting for more referrals to come in before we set our next date.
And in the future, do you have plans to expand?
Yeah, I would say so. We would like to offer it more frequently, back to back. So after a 6-week period, we would like to start another immediately after. So once we get those more referrals coming in, we'd like to have the continuous program.
Yeah. And to speak on that as well, we are looking at, Savannah mentioned earlier, adding an inpatient option as well. So offering our services for the inpatient, whether ARU, and then we're looking at growing to Connorsville in the future as well to offer a lot of our yoga programming, including Love Your Brain, into Connorsville.
Until that happens, if a person was in Connorsville and they wanted to come to the Richmond location, are they able to enroll at the Richmond location?
Yeah, they're able to enroll. Transportation may become an issue, but I know the rehab services has a long list of transportation options available. For our boxing programs, before we started in Connorsville, we had boxers traveling from Connorsville. So yes, they can participate along with the rest of the crew in our Richmond location. So yeah.
Great. What is there anything else you'd like to add about? First, I'll ask Matthew and Savannah about the Love Your Brain program.
I would just like to explain a little bit about the communication part at the end of the program. When we get in a circle and we talk about everyone's personal experiences. So one of the topics we do talk about is recovery versus resilience. So that's typically the week that most of our participants have sort of a breakthrough where they realize that they may not get to be exactly like they were before the injury happened, but then we work through finding new ways to get the same end result. So that's a big part of our program.
Well, thank you. And that seems like a very good, and also it makes the participants very optimistic. Yep. And I don't want to forget you, Jesse. Was there anything that you want the community to know about the athletic training clinic, as well as now that we hope that people will recognize more of your staff when they're at our local sports events?
I guess a couple things that I kind of failed to touch base on was our athletic training visits are only $7 a visit. Very, very affordable for a 45-minute session that you have with the athletic trainer that's up here. The post-discharge program is $30 a month, and we just bill that at the beginning of every month with the first month prorated a little bit. And I would be in trouble if I didn't mention March is National Athletic Training Month, so wanted to make sure to get that out there.
Great. We want to thank all of you for joining us today on Read Beside You. And we want our audience to remember to have an active lifestyle and active brain. And thank you for joining us today on Read Beside You.